Every smile has a system behind it: muscles, joints, and movement. And when that system breaks down, it doesn't just change your smile. It changes how you chew, how you sleep, and even how you feel every day. I'm Dr. Johnson from Toronto Smile Design, and today we'll uncover what happens when that system stops working. And I'll show you step by step how we restore it using a fully digital, functional workflow. Have you ever woken up with your jaw feeling tense, your temples sore, and your teeth sensitive for no apparent reason? You're not alone. Many patients come in after years of chasing symptoms: night guards, Botox injections, patchwork dentistry, even multiple rounds of crowns, fillings, and veneers, all trying to fix what's visible without ever addressing the system behind the smile, the jaw, the muscles, and how the entire bite works together. Here's the truth: everyone wants a beautiful smile, but when the system that supports that smile starts to fail, beauty isn't enough anymore. When your bite collapses, when your muscles stay tense, when your teeth keep wearing down, you start to lose something far more important: your comfort, your rest, your health. That's when most people realize something is deeply off. You wake up after a whole night's sleep but still feel exhausted. Your teeth look fine, but they don't feel right. And that's the moment where real dentistry begins. Understanding how to rebuild not just the appearance, but the function that supports it. Compared to the dentistry I was trained in 20 years ago, what we can do today is on another level. With the advanced diagnostic tools such as digital intraoral scanners, real-time jaw motion tracking, CBCT imaging, and facial scans, we can now create a complete digital twin of each patient. This allows us to diagnose, plan, and treat in a level of precision and predictability that wasn't possible before. So, how do we fix or manage this issue? It always begins with proper documentation and examination. Before we try to treat anything, we have to understand it. That's why in our comprehensive assessment, we fully digitize the patient, creating a complete digital avatar that captures the relationship among the jaw, teeth, muscles, and facial structures. This gives us a precise understanding of what's really happening, rather than just what we see on the surface. Once we have that data, we can make evidence-based decisions. If the analysis shows no significant discrepancies in the bite or jaw movement, then the next step isn't more dentistry, it's collaboration. We work closely with manual therapists and physiotherapists, chiropractors, who specialize in this musculoskeletal system. Their expertise helps muscle tension, soreness, or functional imbalances that may be contributing to the patient's TMD symptoms. Suppose we detect a discrepancy between centric relation and centric occlusion. In that case, our first goal is to create even, harmonious contacts between the upper and lower jaws, but in centric relation first. Okay, I can already hear you saying, what is centric relation? What is centric occlusion, Dr. J? You're losing me. You're absolutely right to ask, and I'll explain it in simple terms. Centric relation, or CR, is the position of the lower jaw in relationship to skull. It's completely bone-based, independent of your teeth. Even if you had no teeth at all, your jaw could still open and close in this position. It's most stable and repeatable joint position. Centric occlusion, or CO, on the other hand, is the way your upper and lower teeth come together when you bite down naturally and comfortably. It's your habitual bite, where your teeth fit together and your muscles feel relaxed. In an ideal world, these two positions, CR and CO, should overlap perfectly. That means your teeth and joints are working in harmony. But in real life, that's not always the case. When there's a slight mismatch between them, the muscles often adapt and compensate. These patients might not feel any pain or symptoms at all. We usually discover these discrepancies incidentally during our digital functional analysis. When that happens, we don't rush into treatment. Instead, we educate the patient, explain what we see, and discuss potential implications for the future. because awareness is the first step to prevention. When we find a significant discrepancy between the CR, centric relation, and CO, centric occlusion, patients usually present with substantial symptoms: pain, clicking, popping, jaw deviation in opening and closing, and even migraines. Before we go deeper, let me share a story that's very personal to me. My wife had 2 rounds of orthodontic treatment before we met. Her teeth looked beautiful, perfectly aligned, but she was struggling with severe TMD symptoms. After we lost her father, the stress triggered even more clenching and grinding, and suddenly her symptoms exploded. She was in constant pain. At that time, I wasn't yet focused on TMD management, but I was fortunate to be working with exceptionally talented orthodontic specialists who understood the connection between the bite and joint health. When they examined her, they realized that her back molars were touching first, the second molars. To fully close her mouth, she was literally forcing her jaw out of position every single time. Imagine dislocating your shoulder every time you try to lift something. That was what she was experiencing with every bite. Her treatment began with splint therapy to guide her joint back into the correct position, followed by an orthodontic correction to align her teeth to her true centric relation. That experience completely changed my perspective. After seeing how much my wife suffered and how predictable her recovery was once the function was restored, I dedicated myself to understanding temporomandibular disorder and jaw function in depth. It became personal. Okay, so how do we actually do this? We start by using some of the most advanced technology available to replicate the patient's jaw motion in real time. This data allows us to design a new, balanced biting surface that perfectly aligns with the patient's centric relation, the actual stable position of the joints. Once that surface is digitally designed, we transfer it to the mouth using a 3D printed upper TMJ splint. Now, this isn't your typical night guard. Think of it as a night guard on steroids. It's not just a piece of plastic to protect your teeth. It's a precision device designed to guide the jaw into a healthier, more stable position. Patients wear this splint 24 hours a day, 7 days a week. Yes, all the time. The reason is simple. The goal is to reprogram the muscles and joints to function in a stable, joint-friendly position. If the splint is removed for long periods, the body quickly returns to its old, traumatic biting habits, the very patterns we're trying to correct. In the early stages of the splint therapy, we see the patients frequently, sometimes every 2 days, to fine-tune and adjust the splint. As the joints and muscles begin to relax, the bite immediately changes. Most patients start feeling significant relief within the first weeks. As symptoms improve and stability increases, we gradually reduce the frequency of adjustments. When the patient reaches a point of comfort, a pain-free and stable bite, we transition to a lower functional TMJ splint. This second phase helps refine the bite further, allowing us to achieve the ideal occlusal relationship and maintain it over time. The entire process is about one thing: giving the system, the joints, the muscle, and the bite a chance to work in harmony again. Now that our patient is comfortable, balanced, and pain-free, we usually reach a crossroads with 3 possible paths forward. Option 1 is to continue wearing the lower splint long-term. While that would technically maintain stability, I personally don't consider it as a proper solution. Expecting a patient to rely on an appliance for the rest of their lives feels restrictive, even cruel. Dentistry should restore independence, not dependence. Option 2 becomes possible once we have identified where the bite should be. We can then align the teeth to that ideal position through orthodontic treatment. This approach is perfect for patients like my wife, whose teeth are structurally sound and healthy enough to be moved. It's minimally invasive, preserves natural tooth structure, and provides long-term stability. So, whenever feasible, it's our favorite path. Option 3 is for patients whose teeth are already worn, fractured, or compromised, where the orthodontic movement alone can't achieve functional harmony. In these cases, we rebuild the bite using minimally invasive and usually additive restorations such as porcelain veneers, veneer lays, or onlays. These restorations allow us to re-establish the correct vertical dimension and occlusal support while also achieving a beautiful, natural, aesthetic outcome. Each option shares one common goal: to maintain the functional balance we restored and give the patient a smile that feels as good as it looks. But please don't get me wrong. Every case is unique, and not every patient needs a splint. Some cases require a completely different approach. That's why the first and most crucial step is always a thorough, individualized examination. At Toronto Smile Design Yorkville Dental, our philosophy is rooted in precision and science. We are committed to provide up-to-date, research-based, clinically proven treatment modalities. That's why we constantly invest in continuing education and advanced technology, including the only module in Ontario, to ensure every diagnosis and every treatment plan is built on the highest possible standard of care. If you're a dentist watching this, understand that this workflow transforms predictability. Real-time kinematics with Mojo, CBC-guided joint assessment, and facially driven design dramatically tighten your feedback loop. It's not just about having better data, it's about making better decisions, faster. And for patients who are watching this, better diagnosis means fewer surprises, less guesswork, and longer lasting results. Here's the question: what happens if you wait? The symptoms rarely stay still. Wear increases, cracks deepen, joints become more inflamed. And what could have been managed may later require complex, costly interventions. Early, accurate diagnosis isn't just more innovative dentistry, it's peace of mind. If this message resonates with you, here's a simple next step. Book a consultation at Toronto Smile Design. We'll listen, we'll map your system digitally, and we'll give you a clear plan that makes sense. And if you enjoy learning how digital dentistry can solve real problems, subscribe to the channel. We will share case stories, bite insights, and behind the scenes looks at how technology and biology come together. You deserve a smile that looks beautiful, feels natural, and functions for the long haul. We are here to guide you with empathy, with precision, and with a plan. I'm Dr. Johnson. Thank you for watching, and I'll see you in the next video.